Hello, so this is chapter 29, Intervention. A definition of intervention. It is organized effort by a person or persons who are part of the person's environment to break through the walls of denial and rationalization that surround the addicted behaviors. It is often supervised by a trained professional and has the goal of obtaining an agreement for the person struggling with an SUD to immediately seek admission to a designed treatment center. A brief history of intervention. Once thought a person with an SUD had to hit bottom before he or she would be receptive to help. Vernon Johnson, 1980, challenged this idea. Early intervention before hitting rock bottom, using a message that is easily to understand, attempts to get the person with an SUD to voluntarily enter treatment. Characteristics of intervention process. Brief alcohol intervention used by physicians. Screening, brief intervention, and referral to treatment. Informal intervention. A request or ultimatum from a spouse. An expression of concern from a friend may come from a supervisor or an employer as a condition of continued employment. The mechanics of intervention. The cornerstone of an intervention is advanced planning. Very useful for one person to act as coordinator. Each participant affirms his or her concern from the individual with an SUD. They express a desire that the person seek help rather than venting anger. Appropriate referral agencies should be identified ahead of the intervention. Once a person speaks with an SUD acknowledges the problem and need for treatment, steps are taken immediately to get the treatment center admissions office. If the person with an SUD refuses help, sanctions are presented and put in place. Detachment has the goal of preventing future enabling by friends and family members. Vague statements of agreement that delay or deflect are not accepted. Compliance without acceptance. Person should be accompanied to treatment facility so that the process of admission is clear and dishonesty can be used to later avoid admission. The ethics of intervention. Fraught with ethical dilemmas. Can the person with an SUD be saved from negative consequences? Can a person be prevented from leaving an intervention? Informed consent, right to refuse treatment, data privacy, conflict of interest, counselors' qualifications. Some common forms of intervention. You have family intervention projects, second to legal pressure to force a person into treatment. There may be damage to family relationships as a result, without malice and in a non-judgmental manner. Emotional power kegs that can go horribly wrong. The Johnson model is the most often associated with the word intervention. It involves 3 or 4 rehearsals before the actual intervention. Participants are educated about the disease model of addiction, reducing the potential for anger or malice. Family members are encouraged to bring written notes, very specific statements. Role-playing may be helpful. Result in a commitment to enter treatment only about 30% of the time. The ARISE model, 3-stage intervention model with increasing pressure. Graduated series of contact with the patient over time with the goal of securing the addicted person's entry into treatment. Stage 1, telephone contact, followed by family therapy. Stage 2, person with an SUD invited to attend family sessions and goal is admission to treatment. Stage 3, more confrontational compared to the Johnson model. Intervention by the legal system can be institutioned via different paths. Treatment or jail, contingency management, theory that external source of motivation may lead to internal motivation, usually viewed as a punitive response. Court-mandated clients found to have experienced fewer negative consequences to their substance use than do clients without legal pressure. Court-mandated treatment. Many insurance companies are by law able to refuse to pay for court-mandated treatment. It is not a guarantee for long-term absenteeism, since long-term absenteeism rates for those who complete treatment at the invitation of the courts are no better than voluntary patients. Outcome is coerced absence. If an SUD represents an illness, how can a court order it to be cured? Goals of the drug court program: access treatment need, identify proper level of treatment, identify best treatment facility for a given client, monitor adherence via therapist reports, administer periodic urine toxicology test, provide reduction in legal charges upon completion, and provide for ongoing care. Intervention by the legal system. Drug courts program. These programs consist of 3 stages. Stage 1, detoxification. Stage 2, stabilization. Stage 3, aftercare. Very time and labor intensive. Do they work well enough to justify the effort and expense? Well-designed research is still needed. Drug court. One problem with the drug court concept is that it is based on the theory that the substance abuse treatment programs that the client are referred to are very effective. Finally, the issue of the individual's motivation for participation in a drug court program must be considered. Court-mandated involuntary treatment, available in over 30 states. Imminent danger of self or others varies from state to state. Very real chance that the client will simply comply with treatment expectations in order to escape the court supervision as rapidly as possible without making any permanent changes in their substance use behaviors. Rare autonomous motivation. Other forms of intervention. Contingency management techniques are often very effective. These are either/or forms of external pressure. Consequences of substance use are presented and enforced. Employer-mandated treatment. Employees may be threatened to be fired if under the influence of drugs or alcohol on the job. A company with just 500 employees will typically spend $133,000 in healthcare costs for alcohol-related problems among employees each year. Reactions against the concept of intervention. Misperceptions is that people are being sent away to get fixed. When does coercion be justified? First, do no harm. Coercion has become such an accepted tool used by mental health or medical professionals. It now does not raise ethical questions from those who wield that power. So that's it for this video. Thank you for listening.